So let's start sharing our real stories regarding reproductive care. I'll go first.
You don't have to have a traumatic experience that led you to needing reproductive health care in order for it to be worthy of talking about how reproductive health care has improved your life. I went on birth control in high school, not even because I needed to prevent pregnancy, but because I had horrible cystic acne. I did 2 rounds of Accutane. And if you know anything about Accutane, I don't know if they still even do Accutane, but you legally cannot do it without being on birth control. If I had not had access to birth control when I was a minor, something they're moving against, I'd still have horrible cystic acne, and I just would have had such a worse time, socially, mentally, emotionally, as a young adult. And that story is in no way as important or as selfless to share as being assaulted and needing care as a result of that assault, care that they're trying to take away. But that doesn't mean it's not important to share. For one, it can't be the entire responsibility of people who have had traumatic experiences like being assaulted to share their experiences to get people to see how important reproductive healthcare access is, but also because they don't want you to think about reproductive healthcare access as being in any way inextricably linked from common mundane parts of healthcare. They don't want you to think about reproductive healthcare access and the things that they are trying to take away as being related to dermatology, cancer care, mental health and behavioral health, regulating your menstrual cycle, or just not wanting to be pregnant. All valid reasons to need access to reproductive health care. To take away abortion, birth control, all these things, they have to gaslight us into this false reality where reproductive health care is something you don't need. It's completely separate from real healthcare that you're worthy of getting. And if you do need it, you could have prevented it. You could have prevented getting pregnant. You could have prevented being assaulted. You could have prevented having this complication. And that's just not how it works in the real world for people and our bodies that can carry and create life. That is how they need it to work in order to legislate our bodies. So it's so messed up that we need people who have traumatic experiences to share those experiences, to raise awareness for these things. But if you have a boring, mundane story about how reproductive health care access has impacted your life, those also matter as well.